Wash my hands. How you doing, sir? My name is Chris King. I'm a nurse student today. Going to do your physical assessment. Can you tell me your name and your birthday, please?
My name is Robert King. Birthday 6/1/56.
Excellent. We're going to start our inspection with your scalp today. I'm going to inspect your scalp for any nits, lice, or infestations. All right. Looks good. Looks good. We're going to move on to your sinus cavities. I'm going to palpate them, and you tell me if there's any sensitivity or pain. Frontal, maxillary. Any pain?
No pain.
Excellent. We're now moving on to your ears or your auricles, sir. I'm going to palpate them, and you tell me if there's any pain or sensitivity.
No pain or sensitivity.
Excellent. I'm now going to check inside them for any serum or blockage. Looks good. Serum or blockage. Nope, everything looks good. Excellent. We're now going to move on to your nose, sir. If you can lean your head back. I'm inspecting the mucous membrane. It's pink and moist. No deviated septum. The septum is midline. Looks good. Can you flare both your nostrils for me, please, sir? Excellent. Checking for patency. Breathe out. Breathe out. Excellent, sir. Thank you. We're now moving on to your mouth. Say ah. Tongue up, out, to the side, other side. Say ah one more time for me. Excellent. Thank you, sir. All right. Mucous membranes are pink and moist. Lips, tongue, gums, palate, pink and moist. No edema, no lesions noticed. Lips are pink and moist as well. We're now moving on to your trachea, sir. If you just tilt your head back for me again. All right. Trachea is midline, no deviation, no bulging from the thyroid gland. Looks good. I'm now going to, auscultate your carotid arteries, checking for any bruit. If there's bruit present, that indicates blockage in your artery there. All right. All right. No bruit noticed. Excellent. All right, sir. We're now moving on to your anterior thorax. Okay. I'm just going to place my hands on your chest. Take a deep breath for me. Chest rises and falls bilaterally. I'm inspecting the skin for any moisture, edema, lesions, making sure skin is the same as it is the rest of his body, consistent. Okay. I'm now going to check some breath sounds, lung sounds. There are 8 of them. Excellent. All breath sounds are clear. No sounds of crackling or wheezing. Excellent. Okay, sir. We're now going to move on to your breast examination. Sir, do you give yourself a breast examination regularly?
Yes.
You do. Excellent. Okay, I just want to educate you a little bit and make sure that you know the proper techniques, because how to do it. Because despite the fact that we're men, we're still susceptible to it. All right, so we take our hand out, put it behind our head. Take your other hand, bring it up to your auxiliary, and in a circular motion, massage all the way down, around the breast, up to the nipple, and then you pinch your nipple. And if there's a discharge there, you want to call your physician and tell him immediately. Okay? Excellent. All right. We are now going to move to your posterior thorax. Okay? Correction. Sir, let me finish you up here. We're going to do a cardiac examination on you now, sir. Okay? We're going to listen to your cardiac sounds. They can be found in your 2nd and 5th intercostal space. Okay? First one, located to the right of your sternum, 2nd intercostal space. This is your aortic valve. Moving over to the other side, 2nd intercostal space to the left of your sternum. This is your pulmonic valve. one down in the third intercostal space is your second pulmonic valve, or Erb's spot. Moving one down to the fourth intercostal space, you have your tricuspid valve, and then moving down to the fifth intercostal space, you have your mitral valve. Okay, and while we're down here, we're going to move just to the right, just left of your mid-clavicular line, and fifth intercostal space, and we're going to listen to your apical pulse. Excellent. All right, thank you, sir. Everything sounds good. No sounds of dysrhythmias or anything abnormal. Okay. Now we're going to move to your posterior thorax. Okay. I'm just feeling the skin. Can you take a deep breath for me, sir? All right. Chest rises and falls symmetrically. I'm inspecting the skin for any lesions, edema, any abnormalities. Excellent, sir. I'm going to check your spine, make sure you don't have no scoliosis or kyphosis. Excellent, excellent, sir. All right. I'm going to listen to your lung sounds on your posterior thorax. There's 10 of them. Okay. And while we're over here, I'm going to go ahead on this lateral side and listen to that last lung sound, that third lobe of your right lung. All right. Sounds good. Lungs sound good. No wheezing, crackling, or any abnormal sounds. Okay, sir. We're now going to move on to your assessment of your upper extremities. Okay. I'm looking at the arms. I'm feeling them, feeling the temperature of the skin, looking for any lesions or edema. Turn them over, checking it out. Everything looks good. I'm going to check. You can rest your arms down, sir. All right. I'm going to check his brachial pulses and his radial pulses, and they're both bilateral and equal. Good. Feel good. Okay. Excellent. We're now going to check your strength, sir. You can push down. All right. Now push up. Excellent, sir. Excellent. Okay. I'm going to inspect the fingers and fingertips for any clubbing, any lesions, anything abnormal. I'm going to check the capillary refill. Excellent. Less than 3 seconds. That's good. All right. Sounds good, sir. If you lay down now, we're going to go ahead and assess your 4 quadrants of your abdomen. Watch your head, sir. Alright. First off, I'm just going to have you take a deep breath. Alright. I'm just going to make sure your abdomen is flat and there's no masses or protruding lumps or anything like that. Everything's good. Okay. I'm now going to auscultate your 4 quadrants of your abdomen. Alright. Starting with your right lower. I'm listening for any hyperactive, hypoactive, absent, or normal sounds. Excellent. All right. Lower right quadrant, upper right quadrant, upper left quadrant, lower left quadrant. Excellent. All sounds were normal. Everything sounded good. If there were absence of sounds, I would auscultate in each quadrant for 5 minutes until I heard something. Excellent. Okay, we're moving on down to your lower extremities. Okay, I'm palpating the skin. I'm feeling the skin for temperature. I'm looking for any lesions, any consistency with the skin on the rest of his body. Make sure it looks good. All right. I'm checking his posterior tibial pulse and his dorsalis pedis pulse. Okay. They're both bilateral and pulsate, right? Good. Okay. All right. We are now going to check your strength, sir. Can you push up? All right. Now push down. Excellent, sir. We're now going to check your range of motion. Okay. Flexion, extension, abduction, adduction. Excellent, sir. You can sit up real quick, and we're just going to, got it? we're going to assess your range of motion in your upper extremities before we're done here. That's our last thing. You just follow along with what I do. Flexion, extension, abduction, adduction. Excellent, sir. Your physical assessment's done. Thanks, sir.
Thank you. That wasn't bad.